Hi, everybody. My name is Richard Giguere, and I'm presenting on my legislative topic. I chose a Senate bill, S 4182, the Emergency Support for Nursing Homes and Elder Reform Act of 2020. I initially was attracted to this bill because it seemed to be concentrating on supporting nursing homes through this current pandemic. Uh, it talks about supplying PPE for nurses and supporting nursing homes through a very trying time. I personally went through this at our facility, so that is what initially brought me to this bill. But I feel like I was a little bit fooled into being pulled into that one topic. And as it will present, I feel that this bill seems to cover a much broader spectrum of ideas and issues related to nursing homes. So here it covers the sections that predominantly dealt with the topics that were presented in this bill. The first two sections had more to do with defining words and terminology used in the language of the bill. But as you can see here, as it begins, it talks about providing resources for personal protective equipment and testing. And then it talks about promoting transparency for COVID-related cases, fatalities, and staffing levels in long-term care facilities, and also establishing a strike team. All of those three things have to do with actually developing resources to help nursing homes through the pandemic. But then, as you see, it sort of moves into a different idea of thinking that the Senator Chuck Grassley was presenting. And I initially was, as I was doing my first reading through all of these topics, I was a little bit confused. And then the more I read into it and the more I kind of started looking into what was going on here, the more it became apparent to me that uh, the COVID piece of this was sort of the hook to get other legislation passed. And I'll describe that as we go through. So here it goes into a little bit of the detail that was in the bills. This is a very extensive bill, many, many pages. I tried to consolidate it as much as I could into what the real meaning of some of these sections were. So here it talks about the personal protective equipment and testing for nursing homes and providing provisions and payment for that section of testing. And then it talks about promoting transparency in COVID for really the reporting, and then also establishing strike teams. All of these things have sort of already been happening in the world today, as opposed to what it was in April when this was sort of really getting started. I've seen the strike team be implemented here in Connecticut, and we definitely have better resources with PPE, and also the transparency and reporting has definitely increased. I know personally I have to report to like three different facility outlets, one to the state, one to the NHSN, and then one other one through another state portal. So definitely there's a lot of reporting happening these days. So all of these things are very important for nursing homes and moving forward through this pandemic. Now here, this is what I'm calling my transitional legislative section. So I felt like, so we went from talking about COVID related topics in this bill, and then we're sort of talking about potential promoting identification and reporting of potential abuse and neglect in long-term care, and then promoting quality of life in long-term care through televisitation. So both those things, I could still see how that relates to what's going on with the pandemic, with the less accessibility of families to their family members, to the residents at our facilities. The televisitation has definitely been key in kind of keeping some of those connections going. There was definitely a lot of legislative acts that had to happen really quick in order to make that possible, with some regulations around HIPAA, and then also there was the concerns about the residents in these facilities potentially getting into situations where maybe they were having some neglect or potential for abuse that people couldn't see. So I could still see how this piece of it connected to the actual legislation. Now here is where I started feeling that we were drifting away from the actual COVID pandemic sections. Here it talks about upgrading nursing homes, compare, and the five-star rating system, enhancing federal oversight over nursing home participation in Medicare and Medicaid, continuing funding for programs to prevent and prosecute elder abuse and neglect, and then also increasing resources to investigate abuse and neglect and extended services for victims. These sections here are very far from where we started this conversation. And I felt a little bit confused when I was reading these sections and seeing the direction that the bill was moving in at this point in terms of what the Senator Grassley was trying to accomplish. I'm not saying that any of these pieces of this bill aren't important and that they aren't things that definitely need to be addressed, but they definitely were. I felt like there was definitely some disjointedness happening here in terms of what was going on. And it ended up leading me into looking into this a little bit further. And then here is the last three provisions of the bill. One, protecting Americans with dementia. Two, reducing racial and ethnical disparities in long-term care facilities. And then three, establishing reciprocity with Drug Enforcement Administration to address improper prescribing of controlled substances. Again, all of these things are very important, things that should be addressed in long-term care. But I mean, you can just see the progression here of how further and further away we are getting from the actual key from the beginning of this bill, addressing COVID and supporting nursing homes, into a whole other arena of thinking here. So as I was looking at this and did a little bit more research, this next article that I found sort of cleared it up a little. So here I started finding maybe more of a true motive behind this legislation. So the bill was sponsored by Charles Grassley. He is a longtime sponsor of elder justice policy. The article that I had found, written by Robert Blancato and Meredith Whitmire, was titled Elder Justice Policy, Where We Are Now and Where Do We Go Next? So this article went into depth about where, and it was written in 2017, and it was addressing some of the steps that had been taken in terms of getting us to where we were today with elder abuse, in terms of talking about the origins of the elder abuse crisis, as they called it. And it talked about how there was broad support across Democrats and Republicans. The original bill that addressed this was co-sponsored by a Democrat and Mr. Grassley here, and it addressed abuse, neglect, and exploitation of the elderly. And as the article went on, it started to kind of move more into generalized elder abuse, into focusing especially on skilled nursing facilities. And it really kind of started digging into and representing skilled nursing facilities as a major source of issues related to elder abuse. So I didn't remember this happening, but I definitely have been on the receiving end of what it looks like to have some of the policies in place now at skilled nursing facilities related to abuse. And I felt a little bit confused because I'm not saying that there aren't some bad apples out there, but generally speaking, the people who care for the residents in skilled nursing facilities truly understand what it is that their job entails. And are there days that there are hard days? Are there days that there is frustration? Yep. But in all the time that I've been working in skilled nursing facilities, I have not once been witness to or heard about someone that I know personally that would attempt to hurt somebody in that way. So I kind of looked into it a little bit. So here I had found a study conducted by Joan Daly and Alice Coffey, and it's a little bit dated. It goes back to 2010, but the reason I kind of went back there was because that's when this elder abuse crisis sort of was initiated and people were really looking into it. And what these authors had done is they did a quantitative study of nurses and aides and asked them some questions. And based on those questions, their conclusions were that staff appeared to be uncertain about what elder abuse really is. So I kind of went in, I read through the article, and as I was reading the questions, I really felt myself kind of questioning if I understood what elder abuse really was. And I feel like what happened was the questions were very ambiguous and they should have been, they weren't yes and no questions. They were discussion questions, such as if someone refuses to bathe and you try to bathe them, are you committing elder abuse? And the answer to that is everyone is entitled to refuse whatever it is that they want, but there has to be discussion and education and ideas presented to try to get to a solution that will be safe for the patient. So when I read this, I was ended up feeling that there were definitely some concerns that I had about research that might have influenced this type of legislation when it was starting to happen. And was there a bias there in terms of what it is that people were really looking at in terms of what elder abuse was? There definitely was a lot of scamming, financial scamming happening of the elderly at that point, and that can definitely be put under that umbrella of elder abuse. But some of the things that they were really looking at in terms of trying to hyper focus on skilled nursing facilities, I just felt like it was maybe a little bit biased. I guess to kind of put it into context in today's world, we see these things happening with police officers, and is it bad? Yep, for those certain few individuals that are involved in that, it's definitely not a good reflection on police officers as a whole. But I definitely tend to believe that those are the few and not the many. So my general reflections on this bill, there's definitely some pros there with it provides COVID-19 support to skilled nursing facilities. There's bipartisan support for these types of issues. It reinforces elder abuse legislation, addresses racial disparity in long-term care, and it also touches on the opioid crisis. But the cons is it uses COVID-19 as a platform for these other agendas. I think that the bill has way too wide a range of topics, which I think will be the fact that it won't ever go anywhere because there's so much in there that there's always going to be someone that's going to, pick at something. I also don't appreciate the aggressive language that they use to address a very complicated situation. And it also had some very language related to the televisitation in there that made me nervous about what doors could be opened by that. Generally speaking, I think that this bill has some good points in it, but I think that it's much too weighted down with too many pieces that it'll actually succeed in going anywhere. Thank you very much, everybody, for listening.